If you or your near ones are having diabetes, have a detailed look at this video and your entire view and understanding of diabetes will change forever. Have you ever felt that even if you are not taking any junk, even if you are not taking any high calorie meals, sweets or sugars, but still your diabetes is not under control? Have you ever felt that even if you are exercising enough, your sugar levels are not under control? Here are your answers to all these questions. Such answers that you will not be getting anywhere on the internet or Google. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything about health. Now, this is a very frequent question of many of my patients, and I'm sure that will be a question in minds of many of you suffering from diabetes. The question is that even if I'm not eating much, why my sugar levels are soaring high? Sometimes these patients also feel guilty on something trivial they have consumed, like something very random that has nothing to do with the rise in blood sugar levels. Today, let's clear all your guilt and misunderstandings and myths surrounding food and diabetes. First things first, diabetes does not occur because of high intake of sugars. What? What are you talking about? Shocking, right? But it's true. The actual mechanism in our bodies is that as much amount of sugar or carbs you consume, the equivalent amount of insulin is secreted from the pancreas to divert those blood sugars into your tissues, like adipose tissue, muscles, and livers. So with that mechanism, if you consume more sugar or more carbs, more insulin will be secreted, and more sugar will be dissipated into the adipose tissue and muscles. Okay, so what's the problem here? Why is everyone asking me to cut down on sugars if I'm having diabetes, if those sugars has nothing to do with diabetes? Right? The answer is, it is not that simple. It is not just 1 plus 1 is equal to 2. Taking sugars will increase your sugars, and taking better things will cut down your sugars. It is not that simple. For example, I have a 42-year-old female who is averagely built. She is not too thin or not too obese, but she is having uncontrolled sugar levels. Such sugar levels that was not controlled on multiple medications. On the other hand, I was having a morbidly obese 82-year-old female patient, and her blood sugar level was absolutely normal. Could you imagine? So what is the most common deciding factor in patients of diabetes? Like, what is the most prominent cause of diabetes? The answer is genetics. Yes, this is a very big revelation. Answer is genetics. The young non-obese female patient I was talking about recently had a very strong family history of diabetes. Her mother, her brother, her father, her first degree relatives, everyone was suffering from diabetes. So now the question is genetics the only factor that affects the onset and progression of diabetes? Again, the answer is no. Because diabetes is multifactorial, and every factor has a different contribution in the actual picture of diabetes. Only having good genes will not prevent the onset of diabetes, and only having diabetic genes will not lead to progression of diabetes. It is that simple. So now coming back to the question, why is your diabetes not under control even if you are taking a very good care of your meal, and even if you are following a very good exercise regime? The reason now you can answer for yourself. Either your first degree relatives or near relatives have diabetes, which is a very strong and prominent factor, or second, you have a problem with your lifestyle. That means either you have a lack of exercise, or you are leading a sedentary lifestyle, or you have high consumption of sugars, or you have high consumption of carbs, or you have a stress taking behaviors, or you have a higher body weight. And yes, the morbidly obese female patient I was talking about The 82-year-old female that was not having diabetes, she will be developing diabetes very soon because she has gained her weight very recently and she is not moving about since last 2 to 3 months. So you can have a forecast, like if you have gained weight very recently or if your lifestyle has changed abruptly towards the negative side, of course, you will be developing diabetes, you will be developing metabolic disorders very soon. So if at all you are eating right or exercising regularly, don't feel guilty about your diabetes, because those are not the only two factors that decides the onset of your disease and the progression of your disease. Sometimes genetics is one of the most prominent factors that decides. So if your family has diabetes, it is like quite obvious to develop those conditions even if you are leading a healthy life. There could be a possibility that you might develop those conditions late in your life. So it is always advisable to follow a healthy life, because had you not followed the healthy lifestyle, you would have developed your diabetes in your 40s. And if you are following a healthy lifestyle, you might develop diabetes in your 50s or 60s. In those age range, diabetes again becomes manageable. So don't feel guilty about it. You are not at fault. Just talk to your doctor. He'll be making a minor adjustments in your medications and you will be all through. Also, very important factor, lifestyle stress, stress taking behaviors can shoot up your sugar levels like anything. So if anything is not present, your genetics are fine, your exercise is good, your meals are good, but still you are having uncontrolled sugars, stress, mental stress could be a factor. Talk to your doctor and get it done. I am Dr. Jay Mehta, signing off for today from Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.